A recent report says both China and the World Health Organization acted too slowly to contain COVID-19. The independent panel for Pandemic Preparedness and Response has been looking at what happened almost a year ago. A group of former world leaders and experts who report to the WHO. Tessa Arcilia is on the story for us from London and has the very latest, the details on who this panel is and what they're saying in this report. Tessa.
Indeed, Heather. Well, the crux of the matter is, according to that panel report, is that the world had been too slow and ineffective in dealing with the virus despite years of warning. So be it China, be it the WHO itself or national governments, it all amounted to the same thing. The reaction and the speed with which everybody dealt with this pandemic was not acceptable. Now, the panel was keen to reiterate that their point is not to lay blame and point fingers, that their point here is to be able to find a solution so that this does not happen again. We just heard from the former Prime Minister of New Zealand, Helen Clark, who just gave a briefing, and this is what she had to say.
The world needs to do two things: act more decisively now to stem the pandemic, and fundamentally to reset preparedness and response systems to help ensure that this can't happen again. And those 2 points are at the core of the panel's progress report.
I mean, there really is a sense of urgency now, Heather, because that report also points out that there will be more zoonotic outbreaks. That means viruses jumping from animals to humans. Now, just to give you an idea, in a 7-year period, the WHO tracked almost 1,500 epidemic events in 172 countries. So they're hoping that this report would be a catalyst, and this pandemic itself would be a catalyst for that change needed.
Something else from the WHO, Tessa, today criticizing the fact that poorer nations are being left behind in the world's pandemic response, that some wealthier nations in the past have been accused of hoarding, and that is Canada, as part of that hoarding vaccine doses. What is the latest from the WHO?
I mean, this is part of the entire response, isn't it, that how fast this can be rolled out, and not just in wealthy countries, because right now what we're seeing is that mass vaccinations are happening on one side of the world, but then poorer countries are getting left behind. The head of the WHO did issue a warning because he says this could potentially be another failure on the part of the world, but this time a moral one. Take a listen.
I need to be blunt. The world is on the brink of a catastrophic moral failure. And the price of this failure will be paid with lives and livelihoods in the world's poorest countries.
He went on to say that what he's seeing right now is a me-first approach. He says this is simply unfair and this is wrong. As far as accusations of wealthier countries hoarding, yes, there are NGOs that say, well, Canada has pre-purchased vaccines that could protect Canadians 5 times over. Now, this is something that a Canadian minister had denied. Hoarding, they said, is not happening. But at the same time, Canada is supporting efforts of the WHO, this rollout of a global vaccine sharing scheme next month. It will start. It's called COVAX. 180 countries have already signed up to that. So hopefully the WHO wants to see some change in this unequal access of vaccines around the world. Heather?